Welcome to Smileworks. This is our weekly FAQ session, first of many, where we're going to be answering the questions which have been asked an awful lot here each week with MJ, who is your dentist, and I am your first officer. So today we're going to be talking about braces. What sort of braces do you have at Smileworks? And that question's from Abby, Jane, Kerry, Jan, Catherine, Charlotte, Anne-Marie, Lisa, Jessica, Michelle, and Ruth.
We've got two types of braces at Smileworks, or two brace systems we commonly use. One of them is Invisalign. Invisalign's great because it's a really sleek system. It's super invisible, hence games in the name. You can remove it when you eat or drink or brush your teeth. And over the course of your treatment, you change your aligners every couple of weeks, and that gradually moves your teeth. So we've got another brace system, and that's called fast braces. That's a fixed system, and you can either have metal braces or they can be clear. Fast braces have some really fancy technology that we can make use of when we're straightening your teeth. The brackets in fast braces are triangular, which means they put force on all 360 degrees of tooth movement, and that means that the teeth move quicker, sleeker, and they reach their position where we want them super swift, which means your treatment is less long, and fast braces are supported by about 20 years worth of really intensive research and a whole load of really smart people.
This question is from Stacey, Chantal, Leslie, Jodie, Sophie, Molly, Rebecca, Abby, Sarah, Jess, Megan, Vanessa, Leslie, Amy, Joanne, Olivia, Tina, Jules, Lindsay, Sophie, and Michelle. What's the difference between fast braces and Invisalign?
Okay, fast braces are fixed. They're fixed onto your teeth. They're like your train track braces, okay, only with a smart difference. And Invisalign are removable. So Invisalign are almost invisible, and you remove them when you eat, drink, or brush your teeth.
Right. Hannah asks, how does Invisalign work if you can take it out?
You change your aligner every couple of weeks, and every time you change it, Invisalign have made a little bit of a difference. So the teeth move bit by bit because the aligner changes shape ever so slightly. So that brings your teeth into their final shape over a longer period of time and makes very small changes very gradually.
Mike has asked on the email, I have a small gap in my front teeth. Do I need braces?
Okay, do you need braces? Nobody really needs braces. Braces are a cosmetic procedure, and they're there to improve the quality of your life and make you happy. Yeah, sure, braces can fix spaces. Other things can fix spaces as well, including veneers, sticking some composite on. Composite is a white filling material. It can be used really effectively to close small spaces. If you've got a slightly bigger space, then we might look at closing it with a brace. The more minimally invasive that we do dentistry these days, the better.
So, been on any fancy composite courses recently?
Yeah, I have. Went to Renamel sessions in Birmingham on Saturday, and it was amazing. Learned lots of really nice techniques that we can be using on our patients to put some really nice things in people's mouths. So we use Renamel, which is made by Cosmodent. It is known as one of the best and one of the finest composites in the world. And we use it right here at Smileworks. It makes some really nice aesthetics, and it makes a really lifelike tooth.
If Renamel was a dental practice, which dental practice would it be?
Renamel would be Smileworks, because it's ace.
Jenny emailed us asking, I had braces as a child. I had braces as a child, and I'm now 30, and my teeth are moving funny again.
Wonderful. Teeth do that. With time, and that doesn't necessarily mean that there's an underlying bad factor. With time, teeth do move because the bone around them grows, and yeah, teeth move in order to reach a position that they're most comfortable in. All teeth move to a certain degree, and braces are a great way of straightening out your smile. After your brace treatment, you will need to wear retainers, and we give you those as part of your treatment here. But with orthodontic treatment, it can be done at any age. So whether you're a teenager, whether you're in your mid-20s, or whether you are in your mid-50s, braces can be used to straighten out your smile and give you the smile that you always wanted.
Bam has asked, can yous make me a retainer? That question also came from Emily, Jenna, Leanne, Michelle and Christine.
We can make you a retainer that is either stuck onto the teeth or it's a removable one. Removable retainers look a little bit like Invisalign, and you wear them to sleep at the night time, and fixed retainers can be stuck onto your teeth, and you don't see them, they go in behind your teeth and they stay there to keep your teeth straight.
This is, a lot of people have asked this question now. This is from Nora, Steph, Shirley, Helen, Sophie, Emma, Jackie, Michaela, Vicky, Teresa and Ellis have all asked, how do you pay for braces? Do you have a finance plan?
We use a finance company called Medenta, who are specialised for dentistry, okay? So they help you in financing your dental treatment or dental plan. We appreciate that not everyone's got a couple of grand in their back pocket to pay for their dental treatment, and sometimes you just want straight teeth, or you want a perfect smile, or whatever it is that you want from Smileworks. So Medenta offer a 0% finance over the course of 12 months, or a interest-bearing finance over anything up to 3 years. So they make it easy for you. You can spread your payments for pretty much as long as you like. And our practice manager Kate can help you with sorting that out.
So how much do braces cost at Smileworks? That's from Lisa Ann, Caroline, Wendy and Jill, Imogen, Jackie, Valerie, Ellie, Aaliyah, Kaylee and Nikki.
Invisalign Full is £3,000 and you get with it retainers and whitening. At the moment you even get whitening for your mate. And we take good care of you. With fast braces, for fast braces metal, so train tracks, it's £2,500 and that includes retainers and whitening for your friend, all of your appointments and a little bit of love from Smileworks. There's other options such as clear brackets for fast braces, and there is an option to have an Invisalign course that's not quite as lengthy, which will, in the Invisalign case, cost a little bit less. And for clear brackets, there's also an option for fast braces, which we can discuss with you at the time of your consultation and whether that's right for you.
Michael wants to know whether he can have braces for his top teeth only.
With Invisalign, it's a little bit more complex because Invisalign does top and bottom arches, so it involves all of the teeth. With fast braces, we can quite easily, if you've got a perfect lower arch, i.e. perfect lower teeth or perfect upper teeth, and you just want to treat either the upper or the lower, we can do that for you. For one arch only, it's £2,000, and it includes whitening for your friend, retainers, and lots of love from Smileworks.
Sarah, Carmel, Lisa and Lee want to know about deposits. Are consultations free and why do I have to pay a deposit?
Okay, consultations are free. And we have a little look at your teeth and discuss all your options with you. However, we are so very, very popular at Smileworks because we're ace, so that in order to secure your appointment, make sure you turn up. We take a deposit off you, which is fully refundable if you decide not to go ahead with treatment, or it comes off your bill if you do decide to go ahead, and we high five you.
All of these wonderful patients have contacted us because they're interested, obviously, in getting braces. Why would you get braces from Smileworks? Because there's plenty of other places in Liverpool you can go.
Come to Smileworks because we're nice, because we're going to look after you, and we're not going to rip you off. One of the big things is, are you getting your value for money? Are you being looked after? And yes, we're going to do both of those things. I'm going to look after you, and we're going to make sure that at the end of treatment, you look good.
From our inaugural office hours here at Smileworks with Ed, our first officer, and MJ, who does all of the fancy dentistry. So, MJ?
Thank you very much. Stay classy.